Welcome to another edition of Health Department Roundtable. I'm your host and current chair of the Board of Health, Chris Schultz. And joining us tonight is our public health nurse, Lindsay Wright, our director of health, Marty Golightly, and also we have the fire chief, John Nuttall, and our EMS director, Justin Silva. Welcome, everybody.
Thank you. Happy Friday, everybody.
So
Thanks for having us again.
We have a lot to talk about tonight. I want to start off first saying I had the pleasure last Friday of helping out at our first clinic for the phase 2, step 1 of our residents 75 and older. And what an incredible experience seeing our departments working together, getting everybody through the door, and how happy these seniors were to be out in their community once again. Seeing people getting their vaccine, the level of professionalism was amazing. Like, you guys just did a fantastic job, and I want to thank you so much for being there. Marty, do you know offhand, or Lindsay, how many people we got through on Friday?
Friday was 87, right?
Yes. Yes. For some of first responder, second doses, and then it was a total of 87.
And we did an elderly clinic that same week on Wednesday, where we did, I think it was 117 total?
165.
165, excuse me. Yeah, 165. So in that week, we were able to do one for 165, one for 87. So, you know, we put together what we thought was a very successful model for how this should be done throughout the state. Couldn't have done it without Justin and the fire crews and the EMS crews and the chief's support and the deputy chief cutter support, and especially a big thank you goes out to Suzanne over at the Council on Aging. She crushed it. Watching our seniors come into the place where they're most familiar with to get the thing that will allow them to come back there someday to hang out and play cards again, as Chris said, was one of the most fulfilling things I've done in a very long time. It was a joy to watch our fire department interact with the seniors in the recovery room while they waited to be able to go. It was a joy to watch our we call them Walmart greeters, and the mobility team at the door as our seniors walked in, and just the joy and downright school kid glee. I mean, it was great, and all of that's awesome. But the one thing I think I am most proud of is that we were able to execute it perfectly safely. No one got hurt. Everybody who came there left of their own accord. And that's the thing that if you were, what's your most proud moment? It would be that we were able to do that from start to finish as safe as humanly possible. And I'm very proud of that. And I'm very proud of the level of coordination between all the departments, and the school department too. The school department was manning our registration along with a bunch of MRC volunteers. So thank you everybody for last week's clinic. And I just wish we could do it again.
Yeah, you guys were so good. We even got a car jump started with a dead battery. So that's the level of commitment. So that kind of leads us into what we want to discuss tonight, which I know there are many people in Abington eager to get their shot, and we have run into some difficulty with that. So I'm just going to kind of turn it over to you guys. I'll
go first. So today at about a little after 17:30 our time, we found out that Abington will not be receiving any more doses, but that will prevent us from doing any clinics next week that are for our seniors. This is heartbreaking news. Up until the minute I got that email, I was hopeful that the state would finally kind of see that the local model is best, and that we would be able to provide another clinic at the senior center and at the high school this week, and give out large amounts because we are approved to do so from the state. We have an approved EDS, which is an emergency dispensing site. We did our walkthroughs. We did everything that we were supposed to do. We went above and beyond everywhere we could, and yet we did not receive any new doses. This is beyond frustrating for us. I don't know whether to laugh or cry or something in the middle, but it is just not, it's not what we wanted to happen. This is not the news that I wanted to come on tonight and talk about. What I wanted to come on and say was, I'm happy to report that we were going to do something, but it's just not the case. And I am truly sorry to our community and to our seniors that we won't be able to do that. But I can promise you one thing is that we will continue to aggressively advocate for Abington to be able to deliver the high quality, safe, effective care and clinics that we know we are capable of putting on. We will continue to voice our displeasure and our disagreement with the state's current model, and we will do everything that we can, and I don't want to speak for the chief, but I'm sure I am right now, we will do everything we can to make sure that we can try to get vaccines as soon as possible. We know what we are capable of. A lot of people know what we are capable of. There's just one disconnect in that wheel, and that's the state giving us the doses. We have busted our humps over the last after the year to make sure that we were able to provide these kind of things. I've lost count of all of the meetings for plannings that me and Justin have had and Lindsay have had just to talk about what do we do about this population? What do we do about this population? We've discussed everything you can imagine, from going to the homes of shut-ins to going to senior housing and making sure that there's an option for them to get it there, to even using the school buses to go to Walmart to pick up those essential workers because they deserve it. They deserve it. To get on a bus that Abington will provide and take them to an EDS and give them a shot and then take them back to work. Because that's what those people deserve. We can't call them essential if we're not going to treat them like that. So we were ready to treat those essential workers essentially and to let them know how much we value them. And to not be able to do that is heartbreaking. And I'm going to stop talking now. I'm sure Chief would love to add something to that, so forgive me if I ramble.
Thank you, Marty. You've explained it extremely well. And the frustration, as you said, just tonight about 7:30, 5:30, we were notified that Abington and every other town around us, and I believe in the Commonwealth, is not going to receive any doses for the community, which it really blindsided us, to be honest with you. Abington has recently used our EDS sites, the emergency dispensary sites up at the high school. We also created one at the senior center with the work that Marty, Lindsay, and Justin have done. And, police and fire have supported that. The machine's there. The machine was working. We tested both the high school site, the senior center site. They're working flawlessly. The machine is ready to go. We're ready to provide the vaccine doses for the residents of Abington. The only obstacle that we have right now is the Commonwealth of Massachusetts, who has, for whatever reason, decided they are now not going to give any vaccine doses to the communities, and instead they are focusing solely on these mass sites, such as Gillette Stadium, Fenway Park, throughout the state, as well as local corporate drugstores, the CVS, the Walgreens, and what have you. Now, there is a place for those, and we're not saying that they should not be doing that. However, the missing piece for this is still a community, because there's a lot of members of our community that are simply not going to go to one of those locations for a number of reasons, whether it's a physical issue, they can't get there. Really, it's fear, to be perfectly honest with you. There's a lot of residents, they simply don't want to go and be exposed to certainly a large clinic, such as Fenway Park or Foxborough Stadium. They don't even want to go to a CVS or a Walgreens. To be perfectly honest with you, we have residents in this town that literally haven't been out of their homes for over a year since this started. And it's out of fear, and it's out of, they simply don't want to risk getting any type of exposure because from what they've seen nonstop for the last year. So what we were able to do is either bring a clinic locally in town if they want to go there, which we did, and we're ready to gear that up. Or in the next step beyond that is to literally go to their homes and administer the vaccination for those residents who want it. And we can do that. We have the capability, we have the staff, we have the vehicles, the apparatus to do that. We could literally go to their homes and administer in a safe environment with very few people there, the vaccinations and take care of them there. That is the part that is missing from the governor's plan, if you will, to roll out the vaccines in the state. It is an abysmal failure in my mind. And a lot of my colleagues, in the fire service are also dismayed. My phone is lighting up as I'm having this conversation now with all the area. The towns are all realizing they're also not getting theirs. And we don't understand what the disconnect is. It actually takes effort to screw up this bad. And I'm sorry I'm sounding negative, but I really am, because I advocate for the residents of Abington. That's my number one thing. And the only thing preventing us from helping the residents directly in Abington is the Commonwealth of Massachusetts right now, because they're refusing to give the vaccines to us so we can take care of our own. Absolutely, there's still residents that could go to the mass sites. They can go to the CVS, the Walgreens, what have you, and we need that, to be honest, because we can't. It's difficult for us to get all over 16,000 residents in town that will want it, but we're really concerned about the ones that are not able to get out there. And we're filling that niche. And Abington's not unique in this. Every community in the Commonwealth is going through the same dumbfoundedness right now when they're realizing all of the vaccines that they have requested are not getting filled. And the second part of this is we've already administered several hundred first doses to residents at these clinics that we've had. We're not getting second doses right now, the way this is appearing. That is a concern, and there's a legitimate fear, I think, for the residents. And I'm not trying to scare people. We're trying to help people. We're trying to advocate for you to get these vaccines so we can get you that second dose as well directly here in town. I can tell you there is a lot of work going on behind the scenes. We've been busy. I have been busy all week, and I know Marty has as well, reaching out to my colleagues directly up to the governor's office with multiple avenues to do that, to try to put pressure on the Baker administration to release these vaccines to the communities so we can take care of our own. If anything, they've doubled down in their efforts to refuse that. And I don't understand why, but I'd like to ask him directly, and we may very well be doing that over the next several days.
Lindsay, I want to throw it over to you. I know that the office has taken a lot of names for people that would like us to come to them. Would you mind speaking on that real quick?
Yeah. So Justin and I were approached at one of the first EDSs that we did by a phase 1 eligible resident whose mom cannot get out of the house. It is not possible for her to leave. And she asked if there was a plan in place to get her mom vaccinated, to keep her safe. And I was so proud and so excited to say, yeah, Justin and I have had lengthy conversations. Chief Nuttall has approved, Marty has approved us going with just the minimal staff required to do this, to provide the nursing and the paramedic care that is required, both for the administration and the 15 or 30-minute watch period after. The woman cried because we were going to be able to offer this. I have taken innumerable phone calls at the office. One thing that is, the phone doesn't, it's very rare in our office that when someone can't get to the phone. And so we talk to them. I've answered the phone so many times this week and have said, we don't know when we're getting doses to do, to start another round of clinics for seniors. Please, in the meantime, don't delay getting your vaccine. If there's other avenues that you can pursue, please do so. And I am met with a resounding, we don't want it from anyone else. We want it from you guys in Abington. It is a trust thing. They talk to Mary, Angela, Marty, and myself, or Suzanne at the senior center and her staff, Amy and Amanda. They talk to one of us to make the appointment. They talk to one of us if they have questions about the vaccine, and then it's one of us, be it myself or Justin and the fire department. It's someone that they recognize giving them the vaccine. So there's a level of trust that comes with that. We do it in the senior center that they're all very familiar with. They're familiar with the parking. They know the layout of it. They know where the bathroom is. They know where the floor might bump up a little bit. They can navigate it. There is no question of how far away am I going to have to park? Is it going to be cold waiting? We have thought of all of it. We have spaced out our appointments enough that we know that everyone is going to be warm. They can come in, they get their shot, they are observed, and then we make sure. I can't tell you how many firefighters I watched arm in arm with one of our residents, walking them out to their car because we had some New England winter weather, and every single resident was safe. And it's crushing to me that the state told us that they would prioritize second doses, and we've put requests in. As a nurse, I don't like that, none of us do, but my job is to fix things. I said it earlier, all of our jobs are to fix things. We're not people that can sit back and say, okay, this is what's happening. We are all going to fight to fix it. And I don't like that the answer that we're getting right now is that they don't want to let us finish what we started, never mind start something new. And it's heartbreaking for me that this is the situation that we're in.
Hey, you mind if I jump in real quick? I'm sorry. I do take this minute to say a few thank yous to Chief Nuttall and to Deputy Chief Cutter, and especially to Justin, who I know he's just a behind the scenes guy. He probably wants to stay that way, but I'm going to pull him to the center stage here because my man has done a significant amount of the planning. I couldn't do this work without him. He when I think I have a good idea, he usually can take that good idea and make it even better. So it's a sword sharpening a sword, as we would say in the military. So thanks, buddy, Justin. You've been great to work with, and I couldn't do this without you. We also met with our Brockton Housing Authority, people that run our housing authorities in town, and I just want everybody in those places to know that you are not forgotten. We have a plan to come to you that was mostly Justin's idea. We have a robust plan if we ever get it, and hopefully we will. Maybe they'll change their mind. So I did want to say that that we are lucky in Abington to have a team who can set ego aside and work hard together and with each other to get the job done.
Marty, if I can just back you up on that. And again, Justin, you've been the tip of the spear for the last year on this, both in terms initially leading the Abington Fire Department and paramedics with maneuvering the ever-changing directions from the CDC, which literally changed by the hour, when this began a year ago, in keeping our members safe and, keeping the residents safe from cross-contamination, the decontamination procedures with your team as well. So I agree. And at that point, once we kind of had our act together, at that point, we kind of let Justin loose to the town with Marty, and they've been running as a team with Lindsay as well. And we're doing it. We're ready to go. Like I said, we're a well-oiled machine. We've just run out of the fuel from the state because they won't give us the vaccines. And actually on that, Justin, would you mind just sharing news that you were telling me as well about this is even affecting the hospitals?
Yeah, so the state made a decision today, came out this afternoon, that they are going to double down on their plan to use mass vaccination sites and corporate pharmacies. And in order to fuel those sites, they are no longer providing vaccines to all the major hospitals across Massachusetts. I just got an email from my hospital group, which is South Coast Hospital Group, where my primary care physician is. And the email said that the state is no longer going to be providing them first dose shots. They're going to finish up the second ones that they did for their patients, and that's it. And South Coast Hospital Group was pretty upset because they had built a really good plan to vaccinate, thousands and thousands of their patients. And, Bristol County which is where South Coast Hospital Group is most prevalent, they've been left out of this. New Bedford and Fall River is difficult to get vaccinations down there. And the state's they're doubling down on this plan. And that includes all the major Boston hospitals that are no longer going to be able to provide vaccinations for their patients, which some of these hospitals serve patients in very low income areas. And that's just really unfortunate for people who can't travel long distances, who trust their healthcare physician that they know. The state is taking those vaccines from the hospitals.
And this is unique to Massachusetts. This is not a nationwide decision, correct?
I'm not exactly sure what other states are doing. I know distribution-wise where we rank across the country, and it's pretty unfortunate. Massachusetts being kind of the hub of healthcare and almost an example of healthcare for the entire country. I think we're according to BeckerHospitalReview.com, this was posted yesterday, we are 38th in the country. I never thought Massachusetts, well, I kind of had an inclination that DPH might not be excellent at this, but 38th is pretty unfortunate when you look at the healthcare in Massachusetts. People come from all around the world for our level of healthcare.
Our institutions of higher learning as well.
38th in the country. It's not something to be proud of.
I also think we should be expediting the teachers. That's just a personal opinion. And I do want to mention it that if we want to get kids back in school, one of the ways we can do is offer our teachers some level of protection. And they deserve it as well.
As you know, we were ready between the whole consortium and Abington to take care of the entire Abington school system staff, not the students, but at least the staff in one day.
And
we're ready to go.
And St. Bridget's, we did not forget about our private schools and our private academies at Preschool Playmates and Jack and Jill and Sunshine. We did not forget about those people either. We had a plan for all of those as well.
Yeah. Early education through K through 12, where it was ready. It is ready. Let me rephrase that. It is ready. And
I don't want it to be all doom and gloom because I still want people to go get shots. So I did send out a constant contact today for a CVS pharmacy list of a bunch of, I think it was about 12,000 appointments. So please check out my constant contact that I sent out. If you can get an appointment, please go get your vaccination because this is how we get out of this pandemic. This is the most important thing. Pride and ego aside and all of that. So please go get your shot if you can. Please go get it and use those appointments. It's just unfortunate that none of the pharmacies listed are in Plymouth County and only one is in Barnstable County. So you might have to travel even to those pharmacies. So please be aware when you're booking those or when you're looking for those appointments. But please look to go get a shot because that's how we get out of this and that's how we can offer protection to us and to our most vulnerable.
to add to that, to see any senior citizen who is having trouble booking appointments, and if again we don't want anyone to delay, would love to be the one to administer it. But 211 is the statewide call center to help seniors get appointments. And so while we're in a holding pattern, like Marty said, please get it if you can arrange that. And 211 will help seniors get appointments. That's what it was designed for.
And I'd like to, as we're wrapping this up tonight, put out a call to action to anybody who's listening or watching. Speaking personally, I'm an idiot who washes rocks for a living, and I ran for an open seat and ended up on this board. Everybody else on this call is a professional who has dedicated their lives to helping people, and I think the level of frustration is evident, and everybody's being very social because we're trying to put on a good face here. But they want to help you, so help us. Call, email, send a message to your representatives, to the governor's office, make your voice heard at your level of frustration that we can't make this happen. That might help. So I want to thank all of you so much for everything that you do. And I wish we had a way to fix this now, but I don't know that we do.
Maybe we will.
We're not giving up. We're still working on it.
Right. It's not for lack of effort. I can assure every resident of that. It is not for any lack of effort.
We are going to continue to aggressively advocate for the residents of Abington.
And hopefully next week we'll have better news. That's what we're hoping for. I should touch on, we usually start these looking at our current numbers. How are we doing today for cases in Abington?
Pretty good, actually. 64 today. When you contrast from a month ago, I'm sure Lindsay will correct me if I'm wrong. We were easily at 160 this time last month. So
we spent
what's helping that? Vaccinations. Please go get your vaccination. Or hey, Governor Baker, if you'd like to send some to me, I promise you, I can do a lot in a day.
Put them to good use.
It's actually not me. It's more Justin and Lindsay. I just walk around and make sure everybody's safe. That's really my position in it.
It is a great team that we have, and we are just missing the stuff. Vial of stuff.
As Rick Collins likes to call it, that sweet
science juice. Well, I want to thank everybody for taking the time tonight to come on and speak with us and get the message out to the audience. I know I think a lot of people will feel better having heard from you guys and getting a slightly better understanding of what's going on, at least what we're trying to accomplish at the local level. So, Lindsay, Marty, John, Justin, thank you very much. And
thank you.
Thank you.
Thank you. Good night.
Thank you. Good night.
Reminder to our audience, if you have questions, please contact us and we'll try to address them at our next Health Department Roundtable next Friday. Thank you very much and have a good night. Stay safe.